Well, guys, if I haven't inspired you to eat right and work out yet, maybe this next story will do it. You may see a lot of commercials for erectile dysfunction. It affects as many as 20 million American men, but when it comes to talking about it, it is a hush-hush topic. In fact, few men want to discuss it. Most just want to ignore the problem, distance themselves from their spouse, or pop a pill and, for a moment, forget that they even have it. But the consequences, they say, could be deadly. ED is often called heart disease below the waist. 68-year-old Gary Sides is back at the heart hospital after suffering a heart attack. This time he's getting an ultrasound, a coronary artery test, to see if plaque is once again building up in his arteries. Choked up, he fights back tears, talking about what he's been through and how it could have been prevented.
Prior to that, I didn't have any idea that I was working my way into that,
What's upsetting, he had 15 years of warning signs, showing up in the form of erectile dysfunction.
Other than the fact that I had the problem, nothing. I never connected the two.
Most men don't. But Gary, like millions of other men, thought that ED was just a problem reserved to the bedroom. Pop a pill and the problem goes away. But doctors warned not so fast. They say if the blood isn't flowing below the waist, it likely isn't flowing above the waist to the heart. In fact, doctors call erectile dysfunction heart disease below the waist.
It's essentially the same disease impacting different parts of your body.
They really are manifestations of the same problem, and that is a problem with the delivery of blood, whether it's in the heart or elsewhere.
Now, nationwide, urologists and cardiologists are teaming up to get their message out.
The symptoms of erectile dysfunction will come up about 36 months or 3 years before the symptoms of heart disease come up. And that really is a window of opportunity that we're trying to take advantage of as a chance to try to identify potentially life-threatening heart disease.
Urologist Dr. Brett Baker thinks Viagra and other pills are great, but says often men just pop the pills and ignore the problem.
It's a patch, but if you don't think there's more underlying the problem than just the erectile dysfunction, then you just fix it and you're happy.
For those men, Gary has a message.
Won't help you much when you have a heart attack.
Gary knows that now, but is angry that doctors, years ago, never told him.
It's putting a Band-Aid on the problem. They never look into the real problem or why you have this problem. They just give you this chemical to put in your body, and that takes care of your problem, and go on, forget about the rest of it.
But doctors say erectile dysfunction can be corrected by cutting out the same risk factors that affect your heart as well.
Obesity, diabetes, smoking, high blood pressure, elevated cholesterol, those are all things that can be managed and can have a positive impact in terms of erectile function.
Gary is now on his way.
Don't eat bacon and eggs every day anymore.
A move for heart health and total body health.
So for all the same reasons that men should try to eat healthily for their heart health, so should they eat healthily for health elsewhere.
So true. And again, erectile dysfunction is not just a part of age, so don't just think that it can't be reversed, because it can. And if you're still not convinced, doctors say the next time you have ED or your spouse does, consider it just as important as chest pains and get to a doctor. It could save your life.